Hey guys, from Casa Johnstone. It's June 10th, 2017. Long time coming, but it's finally here, and you guys are on your way. And I wanted to send you off with some giggles and laughs and some words of wisdom. So let's get right into it. Since one of you's been there for 5 years, or I guess it's just 5 years, it could be more, Megan, a lot of things have happened since you've been in the program at Wilmington. I think Barack Obama finished a term, and then he served another term. We had a ghost president in Hillary Clinton, and then we got Donald Trump. So actually, we've had 4 presidents since you started your residency here. What do you say, Garcia? Would you like one? Yeah, a lot of things have happened. I think Bestie's grown another foot taller. I've grown a couple more hairs. It's good Lord, it's been a long time since you've been here. And now, a lot of things have happened, that have, caused you to be here for 4 years, 5 years. And I'm glad that you're going to a spot along the coast so that, Josh can continue to serve and you can be close by here. And I want to comment about, where you've chosen to practice and live. In North Carolina, there are a few towns that have some, catchy names. In the county north and west of Moore County here, there are two towns, one of which name is Climax, and the other's name is Erect. If there are any children in the room right now, they need to either have their ears plugged or leave the room. But anyway, when you're going to a place called Moorhead, and it just makes me chuckle under my breath when I hear Moorhead, and I can't wait for the first time you send in that or call in that order for your purchase from Nordstrom's or whatever, and they'll say, "Okay, doctor, we've got that number. Now, what is that billing address?" The billing address is 414 South Elm Street, Moorhead. I'm sorry, I didn't get that. That's Moorhead. No, ma'am, I'm sorry, I didn't get the name of the town. It's Moorhead. When you're filling out your North Carolina Medical Board vital statistics sheet and it asks for your practice address. We practice at 2500 West Main in Moorhead, North Carolina. I hope you'll always remember that, and when you're asked where you live or where you practice, or to fill out an application that asks for vital statistics of your residence, that when you write Moorhead, that you'll remember Johnstone and that little chuckle. Dr. Myers. I think the town council in Wilmington has made application to change the name of Wilmington to Las Wilmington, because you came from Las Vegas, you did residency in Las Wilmington, and now you're going to Los Angeles to work. So it just kind of, fits the pattern there. Right after I got here, you had that preliminary slide, and I wrote you a damn good letter of recommendation. And, I was ready to ship your rear end on out of there, and so I wrote a good letter, but it backfired on me because I think Bestie wrote it and he kept you here. Now for 4 years we've been here, and I'm sorry, but too much information about your newest cleanse, your bowel cleanse, your evacuation habit, your menses, your IUD, and just too much information. Too much. Paul, you accepted a position in academics. I think that's great. You've got a lot to offer, but you're going to have to change some things for sure. One of which is when you answer the phone, I think you're going to need to deepen your voice a little bit to give you some, a little more than "Hello, sir," or "Good evening, sir." I think you just kind of maybe need to deepen it a little bit, make it sound a little bit gruffier, Like, "Good evening, sir. especially when you've got attendings from surrounding counties, from Pitt County that are calling in that need help, and they don't want to hear somebody answer the phone saying, "Hello, sir." Just kidding. Just kidding. Just having fun here. Aaron, I was told to go light on you just because you're a sensitive young lady, and I fully see that and had full intentions of going light on you, and I will. But I know that, your residency really, you used it as a way to answer a question on a dating service, like what do you do, and what are your aspirations and goals in life, and you can fill it in with, I'm a OBGYN resident, and I want to be a great surgeon and an obstetrician. Well, it really, it's just a statistic to put in your dating profile so that you could meet someone and get married. I don't think you have any intention of working at all, ever. I think you were just using this as another way of throwing out that line and catching you one, because you caught you one. You got a good one. Amanda, I think I'm going to miss you the most. Yeah, you got good hands, and you're smart, and you're bright, and you're on top of things. But I'm going to miss you the most because you're taking my damn guitar teacher to Austin, Texas. And now I'm going to have to Skype Nick to get a damn guitar lesson. I really appreciate it. Thanks a lot. You're really not looking out for this old man. All right, let's get serious. I've got some advice I want to give you, and I want you to take with you. Pick and choose. If it doesn't apply to you, ignore. Number one is to prioritize what you do and how you live. For me, my rank order list is my faith is number one. Number two are my patients, and number three is my family. As sad as it may seem, your family's not number one. But, over time, your family will recognize that your dedication to your patients and your commitment to them is an honorable thing, and they'll respect you for it. But whatever order you place, your interests and your occupation and, whatever things that you want to rank order, that's your decision. But have a list of priorities so that you can follow that. The second thing is to always be honest. Sometimes it's easy to lie when it's the truth may hurt. But for me, I'm not smart enough to remember who I told what lie. And then it starts a whole another cycle. So if I tell the truth, even if it hurts, I'm very consistent. Everyone knows it. What I say is the truth as I know it. And I don't have to worry about who I told what lie to. The third thing is to listen more than you talk when you're interviewing a patient. We like to impress people with our knowledge, so we like to talk. And we like to talk in front of our patients. But especially when you're encountering a patient for the first time, I think it's more important for you to listen and look rather than to say much. Because if left alone, a patient will tell you what you need to know, and sometimes will give you the diagnosis. Another piece of information or piece of advice is to remain goal-oriented. You're goal-oriented, or you wouldn't have made it this far. But keep your eyes on the horizon. Keep looking forward and up, and always have something that you're working towards. Because after you've practiced for 10 years, you kind of get complacent, and it becomes routine. Sure, there are emergencies and exciting cases and everything, but it becomes kind of routine, and you can get bored. And the whole thing is to have a goal or something that you're working towards or trying to improve in your life. Jimmy Valvano said in his ESPY speech that to know where you are, you've got to know where you've been and where you're going. And first, it sounds a little kind of simple and not profound, but when you think about what he said in those few words, it's very, very true, and is a good way to look at your life, because you've got to look in the rearview mirror, when you're driving, to see what's behind you, to see where you've been, but you always have to keep an eye on the road before you. And by looking in those two directions, you'll always know where you are. Jimmy V also said that to have a full day, you need to, move your emotions to tears, to laugh, and to think. And again, that sounds pretty simple, but as he said, if you do that every day, that's a full day. I always try to learn something, every day. This is take 14 on this damn video, so I've learned a lot about electronics today, and that's the end of it, so far as learning today. I'm down to Truly's now. So Garcia, would you like another one? What else? Know that it's okay to ask for help. You've heard me say that. Good doctors know when to ask for help. Maybe not necessarily to take over a case or give you an official consult, but sometimes you need an extra pair of hands to do what we do. And sometimes you need someone to say, yeah, I agree with what you're doing, to convince you to do what you know you need to do. Which leads me to the last piece of advice, and that is to always trust your instincts. You're bright, you're well-schooled. As much as you think you're not prepared, you are prepared. But sometimes you run across things that a thought pops into your head. I think I've told some of you the story about the patient that I did a vaginal hysterectomy on one day, and the next day she complained of back pain. And I'm thinking, normally I would say, well, your legs were up in stirrups for an hour and a half, and your back's going to hurt. But for some reason, into my head pops, she needs a CAT scan of her abdomen and pelvis. And lo and behold, she had a 7-centimeter solid tumor on her right kidney, on the pole of her kidney. That was a renal carcinoma, and it just popped into my head. It was not my normal routine or way to handle things. So, again, if you think about it, explore it. I want to appreciate what you guys have taught me in these 4 and 5 years. I've learned a lot from all of you. Know that we're always here for you, no matter if you're in Los Angeles or you're in Austin or you're in Nashville or you're in Greenville or you're in Moorhead. You can always call, and I want you to remember where you've been, and to know where you came from, and remember your parents and your family and your school and your town, but also remember your residency, because as much as you might not like to admit it, these years that you've spent here honing your skills and becoming who you are will affect you the rest of your professional career. I wish you well. I'm going to miss you all. Please stay in touch. Have fun tonight, and be safe. And cut.